What if I told you that the biggest threat to your health after 65 isn't your age, but the way some doctors see you the moment you walk into their office? Too many older women are misheard, misunderstood, and quietly pushed aside, told their pain is just getting old, their symptoms nothing to worry about, and their questions brushed away. I've spent decades in medicine, and I can tell you this, it's not just unfair, it can be dangerous. Today, I'm pulling back the curtain on the unspoken biases that could be costing you real answers, real treatment, and real quality of life. And I'll show you how to protect yourself every single time you sit in that exam chair. Stay with me, because by the end, you'll know the exact red flag phrase that tells you a doctor has already stopped taking you seriously. Before we begin, I want to hear from you. Where are you watching this from, and what time of day is it right now? Share it in the comments. I'd love to know, even if it's just an ordinary moment in your day. And if you find this helpful, don't forget to hit subscribe so you never miss the next conversation that could change your health for the better. Part 1. The "it's just old age" assumption. For many older women in America, the first obstacle to getting proper care isn't the illness itself. It's the way their symptoms are judged before a single test is run. The moment you mention your age, some doctors silently put your complaint into a mental box labeled "just old age." And from there, every detail you share gets filtered through that bias. You say you're tired all the time, and they shrug. You mention your knees ache when you climb stairs, and they nod knowingly. You feel foggy, forgetful, or off balance, and they tell you it's normal at your stage of life. It sounds harmless at first, but it's not. That mindset can delay diagnoses, miss early warning signs, and, in some cases, put your life in real danger. I have seen women lose precious time because a doctor decided a symptom was just aging, instead of investigating further. One patient, Joan, was 72 and still active, walking her dog every morning and meeting friends for lunch twice a week. She came in with chest discomfort, nausea, and a strange dizziness. The first doctor told her it was probably indigestion, maybe something she ate. "Watch your diet," he said, and sent her home. But Joan's instincts told her something was wrong. She went to another physician, who ordered an EKG right away. It turned out she was having small but repeated heart attacks. Without that second opinion, she could have collapsed days later, and no one would have connected the dots until it was too late. That is why I always tell my patients, and my friends, that age is a factor, not a diagnosis. Your body may change with the years, but every symptom still has a cause that deserves to be explored. Fatigue could point to heart disease, thyroid problems, or anemia. Memory lapses might signal a vitamin B12 deficiency, sleep apnea, or early dementia that could be slowed with treatment. Joint pain could be arthritis, yes, but it could also be an autoimmune disorder that responds to the right medication. The danger is not in having these conditions, it's in never knowing they exist until they've advanced too far. Part of the challenge is psychological. Many older adults, especially women, have been taught not to complain, to tough it out, and to accept discomfort as part of growing older. You don't want to be a burden to your family. You don't want to seem dramatic. And in the busy, rushed environment of most clinics, it's tempting to let the doctor's quick answer be the final word. But in reality, your comfort, your clarity, and your quality of life still matter just as much as they did decades ago. This isn't about demanding unnecessary tests or doubting every professional opinion. It's about recognizing when something feels off and refusing to have it dismissed without explanation. If you walk out of an appointment with more questions than answers, if your symptoms are waved away without even basic labs or imaging, that's a sign you need to speak up, or seek a second opinion. You're not challenging the doctor's authority, you're protecting your health. Think of it this way. If a younger person walked in with sudden fatigue, unexplained pain, or trouble remembering things, a good doctor would check for a wide range of possible causes. You deserve the same approach, no matter how many birthdays you've celebrated. The human body, at 65 or 85, still sends signals when something's wrong. Those signals don't become meaningless because of a number on your driver's license. Here's a practical way to guard against the just old age trap. Before your appointment, write down your symptoms in detail, when they started, how often they occur, what makes them better or worse, and how they affect your daily life. Bring that list with you and hand it to your doctor. This makes it harder for vague reassurances to replace real investigation. You can also ask specific follow-up questions like, "What else could this be?" Or, "What tests would help rule out serious causes?" These are polite but firm ways to remind your provider that your concerns are valid and deserve more than a passing glance. If you leave an office with only a generic, "It's probably just aging," you have every right to request a clearer plan. That could mean scheduling follow-up visits, getting referrals to specialists, or asking for targeted tests. In some cases, it might mean finding a doctor who treats you like the capable, attentive adult you are, not a number in a chart. The truth is, you can't stop your body from aging, but you can stop your symptoms from being ignored. You can take ownership of your health by pairing your lived experience with a willingness to ask for clarity. This doesn't just improve your chances of catching problems early. It sends a message to every provider you meet. My life still matters, my voice still counts, and my health deserves attention. And as we move forward, we'll explore even more hidden assumptions that can affect the care you receive and how to spot them before they cause harm. Part 2. The not tech-savvy assumption. One of the quietest but most damaging assumptions I see in healthcare is this idea that women over 65 can't handle technology. Some doctors picture you as someone without a smartphone, without an email address, without any interest in navigating an online health portal. They imagine you can't download an app, read lab results on a screen, or follow an electronic treatment plan. Because of that picture in their minds, they skip the explanations that younger patients take for granted. Instead of walking you through how a new medication works, they just say, "Take this twice a day," without telling you what it is, what side effects to watch for, or what to do if you miss a dose. They might not mention that your test results will be posted online. They may skip sending digital reminders for appointments or lab work, and they often don't ask if you prefer printed instructions, leaving you to rely on memory alone. This assumption has real consequences. I have seen older women go home with a prescription they didn't fully understand, take it incorrectly, and end up back in the hospital. One patient, Margaret, 71, was prescribed a blood thinner after a minor stroke. Her doctor told her to just take one every day, but never explained the importance of consistency, diet interactions, or the need for regular blood tests. Margaret missed doses on busy days, ate foods that interfered with the medication, and within months suffered another clot. This wasn't because she was careless, it was because no one took the time to explain. The irony is, many women over 65 are more organized and detail-oriented than people half their age. You have managed families, budgets, community projects, and sometimes entire businesses without the internet's help. Now that you do have technology, you use it in ways that work for you, maybe to pay bills, stay in touch with loved ones, or check the weather before a trip. The problem isn't your ability to understand. It's that some healthcare providers decide, before asking, that you won't. When this happens, you are left to piece together instructions from memory. You might mix up medications with similar names. You might not realize an important follow-up was scheduled in the online portal. You could miss early warning signs of a side effect simply because no one told you what to look for. And then, when things go wrong, the blame falls back on you. Non-compliant, they might write in your chart, as if you chose not to follow instructions, when the truth is, those instructions were never clearly given. You deserve better than that. You deserve clear, thorough explanations, just like anyone else. If a provider assumes you won't use technology, take the opportunity to surprise them. Let them know you want to understand, that you can learn new tools if needed, and that you expect the same level of detail they would give their youngest patient. Here's a simple way to take control. At every appointment, bring a small notebook or use the Notes app on your phone. As the doctor speaks, Jot down the names of medications, doses, times, and reasons for each one. Ask, "Can you give me a printed copy of my instructions?" If the office uses an online portal, request a brief demonstration or have them print a how-to sheet. If they send results electronically, ask them to call you as well to discuss them in plain language. Another powerful tool is bringing a trusted friend or family member to appointments. They can help listen, ask follow-up questions, and make sure nothing gets lost in translation. This is not a sign of weakness, it's a sign of commitment to your health. In fact, many younger patients bring someone along for exactly the same reason. Remember, technology in healthcare isn't about replacing personal care. It's about giving you more access to information, more ways to manage your treatment, and more opportunities to catch problems early. But none of those benefits matter if you aren't given the keys to use them. By speaking up, you protect yourself from the quiet harm of being underestimated. You set the tone for every future interaction. I am capable, I am paying attention, and I expect the information I need to care for my own body. And when you do that, you transform that not tech-savvy label from a barrier into a reminder that you control how your care is delivered. In the next section, we'll look at another dangerous assumption, one that cuts even deeper, when your pain is underestimated, minimized, or ignored altogether, and how recognizing it could save you from months or even years of needless suffering. Part 3. When your pain is underestimated, for generations, medicine has carried a quiet but harmful bias when it comes to women's pain, especially the pain of older women. The idea lingers that if you've reached a certain age, you've learned to live with discomfort, and if you can still function, it can't be that serious. Too often, this unspoken belief shapes the way your symptoms are handled. You may hear phrases like, "Let's just keep an eye on it," or "That's normal for someone your age." And while those words sound gentle, they can be dangerous. I have seen women walk into a clinic describing sharp, unrelenting pain, only to be told to take over-the-counter medication and rest. One patient, Rita, was 76, still gardening, walking her dog, and enjoying her independence. She began having intense hip and pelvic pain. Her doctor dismissed it as arthritis, something everyone your age has. No imaging, no further questions, no referral. 3 months later, when she sought a second opinion, scans revealed a fractured pelvis. She had been walking on that fracture the entire time, making the injury worse and her recovery much harder. Another case still haunts me. A woman in her early 70s suffered persistent abdominal pain. Each visit ended with the same diagnosis: constipation. By the time someone ordered proper imaging, she had advanced ovarian cancer. Early detection could have offered more options, but the delay cost her precious time. These are not rare, isolated mistakes. They are the natural result of assuming that an older woman's pain is less urgent, less believable, or less fixable. Pain is never just part of aging. While wear and tear can certainly contribute to aches and stiffness, new or worsening pain is a signal. Your body's way of saying something has changed. Ignoring that signal risks letting small, treatable issues grow into serious, life-altering problems. This is especially true for older adults, because conditions like fractures, infections, and certain cancers can progress faster or cause complications more quickly as we age. I understand the hesitation to push back when a doctor seems confident. You may not want to seem difficult, or you might think they know best, but here's the truth. No one knows your body like you do. If something feels different, sharper, or more persistent than your usual aches, it deserves attention. Here are a few steps that can make a real difference. First, track your pain before your appointment. Write down when it started, how often it happens, what it feels like, and what makes it better or worse. Bringing this record to your doctor provides concrete details that can't be waved away as easily. Second, if the response is "let's monitor it," ask specific follow-up questions. What exactly are we looking for? How long should we wait before rechecking? What tests would help rule out serious causes? These questions gently but firmly move the conversation toward action. Third, Don't be afraid to request imaging or referrals if you believe something is being overlooked. You are not overreacting. You are advocating for yourself. And if your concerns are still dismissed, a second opinion is not just your right, it may be your lifeline. You have spent a lifetime learning when to trust your instincts. That wisdom matters here. If your inner voice says, "This isn't normal," listen to it. Pain is your body's alarm system, and silencing the alarm without finding the cause is never the answer. The good news is that with persistence, many women do get the care they need and recover well. Rita, after finally receiving the right diagnosis, had surgery and physical therapy, and today she's back in her garden. That could be your story too, if you refuse to let your pain be minimized. Your age does not erase your right to relief, your right to answers, or your right to live without unnecessary suffering. By speaking up, documenting your symptoms, and seeking the care you deserve, you take back control over both your health and your future. And as we move forward, we'll talk about another silent assumption that can impact your well-being, the belief that your intimate health no longer matters. Part 4. The no longer sexually active assumptions. One of the most persistent and damaging myths in healthcare is the belief that a woman's sex life simply disappears after 60. Some doctors, often without realizing it, stop asking older women about intimacy, sexual comfort, or relationship changes. They assume you no longer have interest, that your body no longer responds, and that your romantic life has faded into the past. Because of that assumption, entire areas of your health can be overlooked. When sexual activity is presumed to be irrelevant, important screenings and conversations vanish. Doctors may skip pelvic exams, STI testing, or discussions about vaginal dryness, hormonal changes, and discomfort during intimacy. The silence isn't protective, it's harmful. Many conditions, from infections to early-stage cancers, can be detected and treated early during routine exams. Without those check-ins, small issues can grow quietly until they become far more difficult to treat. I think of one patient, Celia, a 68-year-old widow who had recently started a new relationship after years alone. She was happy, hopeful, and beginning to feel a spark she thought was gone forever. After a few months, she began to notice pain and bleeding during intimacy. When she brought it up, her doctor dismissed it as just aging, without examination or testing. 6 months later, when the discomfort became unbearable, she came to see me. We found untreated infections, significant tissue atrophy, and early signs of tissue breakdown, issues that could have been addressed quickly if someone had simply taken her seriously. The truth is, sexual health is part of overall health at every age. Physical intimacy can support emotional connection, reduce stress, improve sleep, and even benefit heart health. And just like any other aspect of your well-being, it requires attention, honest discussion, and sometimes treatment. There is no age limit on deserving comfort, safety, and satisfaction. So here's my advice. If your doctor doesn't ask about your sexual health, bring it up yourself. You can say, "I'd like to discuss any changes I've noticed during intimacy," or, "Can we talk about screening for STIs or addressing dryness?" And if the doctor seems uncomfortable or dismissive, that is a sign to find someone who will listen without judgment. You are not defined solely by your age or by the assumptions others make about you. You deserve full, respectful, age-inclusive care that sees you as a whole person, not just a number on a chart. When you speak openly about your needs, you not only protect your health, you remind the medical world that older women live fully, love deeply, and value every part of their well-being. Next, we'll discuss another subtle but dangerous bias, the belief that once you reach a certain age, you're no longer worth aggressive treatment, even when your health and your future depend on it. Part 5. The not worth aggressive treatment. Assumption: there's a quiet but powerful bias in medicine that too many older adults face. The idea that once you reach a certain age, aggressive treatment is no longer worth it. Some doctors decide, often without asking, that surgery, advanced medications, or newer therapies carry too much risk for someone in their 70s or 80s. They may tell you, "At your age, we usually keep things simple," or it's probably not worth the side effects. While these statements can sometimes be based on genuine concern, they can also mean that the decision has already been made for you before you even know your options. The cost of that assumption is high. It can mean losing the chance to cure a condition rather than just manage it. It can mean missing out on years of good quality life that could have been possible with the right treatment. And perhaps most damaging, it can strip away your voice in the conversation about your own health. I remember a patient named Linda, 74 years old, diagnosed with breast cancer. Her first doctor recommended hormone pills only, no surgery, no referral to an oncologist. He admitted later to her daughter, "She's not young, we want to keep things simple." But Linda was active, still running her own small business, traveling, and making plans for the next decade. Simple wasn't what she wanted. She wanted to live. She found another doctor, received surgery and follow-up care, and 4 years later, she's cancer-free and enjoying the life she fought for. The truth is, age alone should never determine the strength of your treatment plan. Your overall health, your personal goals, and your willingness to take on certain risks matter far more. A fit 78-year-old who wants to stay active might be a better candidate for surgery than a 55-year-old with multiple serious health conditions. That's why blanket decisions based on age do a disservice to patients. Here's what you can do. When facing a diagnosis, always ask for every available option, from the most aggressive to the most conservative. Request clear explanations of the benefits, risks, and recovery expectations for each choice. Then weigh those options against your own values and lifestyle. Remember, you have the right to say yes to more treatment, or to say no, based on what matters to you, not on someone else's assumption. If a doctor seems hesitant to discuss certain treatments because of your age, you can say, "I'd like to understand all the possible approaches so I can decide what's right for me." Those words gently but firmly put the decision-making power back where it belongs, in your hands. Your life is still valuable, your time is still precious, and your ability to choose how you spend that time should never be taken from you. By asking questions, seeking second opinions, and making informed choices, you can make sure that age is never used as an excuse to limit your care. Next, we'll talk about another subtle form of bias, the belief that you're set in your ways and won't make lifestyle changes, when in reality, change is possible and powerful at any age. Part 6. The can't change lifestyle. Assumption too often, doctors walk into the exam room already convinced that older adults won't change long-standing habits. They assume that if you've been eating a certain way, avoiding exercise, or keeping the same sleep routine for decades, you're not likely to try something new. Because of this belief, they skip important guidance on nutrition, safe exercise, and better sleep. Things that could dramatically improve your energy, independence, and quality of life. But the truth is, change is possible at any age, and the benefits can be remarkable. I remember Evelyn, who was 80 when she decided to start lifting light hand weights a few minutes a day. She paired this with simple changes in her meals, less sugar, more fresh vegetables, and lean-fat protein. Within 6 months, she was stronger, steadier on her feet, and her doctor even lowered her blood pressure medication. Evelyn didn't just improve her health, she proved that age doesn't close the door to progress. If your doctor doesn't bring up lifestyle improvements, take the lead. Tell them you want a safe exercise plan, ask for nutrition advice, or request a referral to a specialist who works with older adults. These small steps send a clear message. You're ready and willing to take action. Your willingness to change tells both you and your healthcare team that your story isn't finished. Age is not the end of growth. It can be the beginning of a stronger, healthier chapter if you claim the right support and take the first step. I hope today's conversation reminded you that your voice, your choices, and your health still matter at every single age. The more you understand these hidden assumptions, the more you can step into each appointment prepared, confident, and ready to be heard. Remember, while we've shared important insights here, nothing replaces the care and guidance of your own doctor. If you have any specific symptoms or conditions, please see a healthcare professional who can give you the personal attention you deserve. These tips are shared for general awareness. If you're facing any health challenges, be sure to check with your doctor before trying anything new. I'd love to hear from you. Share in the comments what resonated with you most today. Or simply type the word HOPE if this message gave you even a little encouragement. If you found this helpful, please hit subscribe, turn on the notification bell so you don't miss future videos, and consider sharing this with a friend or loved one who might need it. Until next time, may your days be filled with steady steps, clear skies, and the quiet confidence that comes from taking good care of yourself.